You'll join me every Saturday morning from 9 a.m. to 11 a.m. for my weekly show, The Home Team, heard right here on the Can Talk Radio Network and Facebook Live, The Home Team with Paul Porter, talking Lightning, Bucks, Rays, USF, and a whole lot more. Your calls and prize giveaways. Join us this Saturday and every Saturday morning for The Home Team, 9 to 11 on the Can Talk Radio Network.
Tune in Saturdays from 3 to 5 p.m. for Miss Sarah's Dynamic Gospel Power Show. That's 2 hours of great gospel music every Saturday from 3 to 5 p.m. All brought to you by the Ozona Pig Restaurant in Ozona. Yes, that's every Saturday from 3 to 5 p.m. It's Miss Sarah's Dynamic Gospel Power Show. Tune in on the Tan Talk Radio Network.
Hello there, Tampa Bay. This is former NFL and college football coach Jimmy Johnson. Listen to the Kelly Show every Monday starting at 5 p.m. They can sure use the attention.
And this is former Major League Baseball player, Hall of Famer Wade Boggs. I also hope you listen to the Kelly Show every Monday starting at 5 p.m. They can darn sure use the money.
Hi there. This is marine wildlife artist and conservationist Dr. Guy Harvey. Please listen to the Kelly Show every Monday starting at 5 p.m. They need to feel worthy.
This is the Tan Talk Radio Network.
It's now time for Connecting Caregivers with author, speaker, caregiver advocate, and talk show host Linda Burhans, the gal who cares for caregivers.
Around the world today, it's time to lift you up. It's time to celebrate. Good afternoon and welcome to Connecting Caregivers with me, Linda Burhans, the gal who cares for the caregivers with love, laughter, and lessons learned on the show where you can find help and hope. And with us, we got Mr. Ed on the boards today. How you doing, Ed?
Happy Friday to everybody.
Happy Friday. Happy you're here. And with me is my best friend, my co-host, my sidekick, not psychic, Lynn Thornley.
Good afternoon. Nice to be here.
Are you having some troubles here with your headphones or something?
Always. It was perfect, and then
we're a little technically challenged occasionally.
We're going to have a little class on headphones after the show.
Yeah, we've only been doing this for, I don't know, how many years now? 8 years?
We need the old plugs.
We need the old plugs.
Yeah. They're on the desk, and some of them are in the coffee mugs.
Oh, okay. We'll have to look. All right. So today we have on the show Lori Schellenberg and Nguyen. Thank you, both of us, for being here today. We're going to chat in a little bit. I'm so glad that you're with us. First thing I want to do is give a shout out to our newest listeners. We have Jesse in Clearwater. We have Paulette in Largo. And we have Maureen in St. Pete.
Welcome, ladies.
That's right. And like I always say, there's plenty of room around the Connecting Caregivers table for more listeners, whether you listen when we're live on AM and FM or on YouTube or Facebook or my website or wherever they'll take us. We're just here to help you. I am so blessed to be part of this community of professionals that really want to make a difference in the lives of caregivers and their loved ones. So if at any time you have a question during the show, please feel free to call in at 727-441-3000 or email me at any time. You can go to my website, lindaburhans.com. If you have a question about something, if you have a suggestion about something, and especially if you have a question about something and I don't know the answer, I'll find somebody that knows the answer, I promise you. So please know that we're here to help you. So what I want to do right now, though, is take just a minute. My friend Brian LeBlanc went to the Lord this week. Brian was a very good friend of mine. He was an advocate for Alzheimer's. He spoke about Alzheimer's when no one was speaking about it. And he was out there and he was raw and he was honest. He's been on the show quite a few times. He was part of some of my conferences and he was a good friend. God bless him and God bless Maureen. I know that Brian's in a better place. I know Maureen is going through a lot now after that caregiving journey because it's a tough thing. But I got to tell you one thing I think would make Brian smile. It was about 2.5 years ago was when the new Elvis movie came out. Brian really liked Elvis. Maureen didn't like Elvis. I said to Brian, you want to go to the movies? Yeah, that would be great. So I drive up to Countryside and I pick him up and we go to the theater, but it was a theater I was never at before. It was in a mall and I had never been there before and I don't know where I'm going. And finally I find some people and I ask them and they go, just follow us. So we get there and we go in the theater and we're sitting down and I'm probably like 5 minutes into the movie, and Brian says to me that he has to go to the bathroom. Oh, I didn't think, was I supposed to ask those questions? Like, can he go by himself? Do I need to go with him? He's a grown man. So I'm like, Brian, are you okay to go by yourself? And he goes, yeah, it's right outside the doorway. I saw it. It's right outside here. I'm like, okay, good to go. So I'm like timing him, and he came back after a little while. Well, 2 more times during the movie, he has to go to the bathroom. Every time I'm having a breakdown, and I'm responsible for him. So the movie's over, and he goes, that was so great. Can we do this again? I said, no more big gulps for you. You're only allowed to go to the bathroom one time with you. It's a little stressful. Oh, now we come walking out of the theater. I don't know where I am. I have no idea. We just followed those people. They just sent us there. I go, Brian, I don't know where the car is. He goes, really good. The Alzheimer's guy and you, Linda. We're really going to get a long way here. And so finally I find a security guy. And he goes, did you come in near the restaurants? Yeah. We came in near the restaurants. Okay, go down the escalator, go there. So we do that. And as we're exiting the mall, there's a bacon restaurant. And Brian says to me, remember when you came in, you said if we get lost, remember the bacon restaurant? No, I don't remember that. Don't tell Maureen. We'll never be able to go out again. But it was a pleasure, and I will always miss him, my dear, dear friend. So, Lori, I'm so glad to meet you in person. We met, there's gifts of LinkedIn and the internet and things like that where you get to meet new people. And I'm so glad that you're here today. And you're a patient advocate. And I don't think people have any idea what patient advocates are. But first, I'd like you to just give our listeners a little background about yourself and how you got to be doing what you're doing.
Well, I've been a nurse for 44 years and retired 3 years ago. And
I don't think nurses ever really retire.
They don't. And besides that, I was a caregiver for my dad and also still for my mom, not 24/7, but I'm the main caregiver for her. And so after I retired, that lasted about 2 weeks. And I was like, I don't know what I'm going to do with myself. I'm not a bingo player. I'm not a bowler. I'm not a golfer. And I started realizing, we live in a 55 and older community, and I started really realizing how many elderly we have in Florida and how many elderly live alone. And so I reached out to a friend of mine who's in HR, and I said, I need to do something. I don't want to be a bedside nurse again or continue in case management because I wanted something more fulfilling. And she said, have you ever heard of patient advocacy? And I said, only in the hospital. And I didn't have very good luck with patient advocates.
It usually isn't.
I had to end up going up the chain to the CEO of hospitals to get advocate for my dad. So I was like, I don't know if I want to do that. And she's like, no, Lori, there's this new profession. It's been out for about 10 years. And you don't have to be a nurse, but a lot of nurses do it. And it's something that you can do as an independent person and have your own business. And I'm like, okay, I'm 62 years old. I don't know anything about business, but you know what?
You figure it out.
Yes. And so that's what I did. I joined a network down here in Florida, a network of patient advocates where I met Maureen. And I don't know if you know the story of Maureen and I, but she snagged me. She started watching me on the meetings, and she was looking for a nurse to partner with because she's not a nurse. And she kept watching me month after month. And finally we met up.
She studies people,
She said, that Maureen, she's probably listening too. So anyway, so I learned what I could. And then in 2022, I turned the lights on in January and waited until the end of February when I got my first referral. And it couldn't have been a better first referral because it was a snowbirder couple from Maine that were down here in Clearwater, actually. And I ended up advocating for him and communicating with their primary care doctor back up in Maine to help to coordinate his care. Very interesting case, and then ended up helping some with wife too. She had some medical issues, and so I was there to help coordinate that. No family in the area, but the interesting thing was the daughter that was the main caregiver would fly. She was an airline flight attendant, and she would fly in monthly. She got her stops so that she's here, and she would come in to fill his meds and check on doctor's appointments. And
that was a good
she
deal.
Reached out to me because they were having more needs in between hers. And she says, I just can't do this, but I need somebody to help coordinate their care and to check on them and go to doctor's appointments.
Because so many times we have an 80-year-old woman taking care of an 85-year-old man. They can barely take care of each other, and they need somebody like you that can come and step in, because since it gets so difficult for them, they don't do what they need to do.
They don't. And that was the concerns of the family. So we were able to I say we're like a quarterback, patient advocates are, because we are overseeing the physical therapist or any of the resources that they may need. We're the one that kind of sets up that treatment plan. We're the ones that go to doctor's appointments to be a second set of ears. We're the ones that communicates with that family at large, which could be all
and
over
especially
the
doctor's appointment. I'm telling you, when I took my mother to the doctor and the doctor said she had cancer, I didn't hear one word he said after that. Not one word.
When I go with my mom, it's really hard because I'm the daughter, and
you need to bring a recorder.
I do. I mean, I'm taking notes and everything, but I'm also watching my mom. And I have a story to tell you about my mom when we finish. But and so it's been an amazing journey. We provide, we go to doctor's appointments, we go to the hospital to meet anywhere along the continuum. Sometimes I've gotten calls from family that the patient is in ICU, they're not getting answers, they don't know what to do, they're frustrated. Usually that's one of the big calls we get. And then we'll stay with the client throughout their stay to the different units, work with the discharge planner to get them home, but we don't just say here and hand it off. Like
you stay with them.
We stay with them. We make sure everything's okay at home, make sure that the services that had been coordinated.
And is it good for them to go home? Maybe it's time for them to start thinking about.
Exactly. And so we're in the home and we're talking to the family. We see the bigger picture that they don't always see in the hospital.
Right.
And even home health, if PT and OT is in the home, and you can probably attest to this too, but when they're in the home, they're in a silo because they don't have a lot of time. They're very, very busy. They don't have time to coordinate the care or to see whatever, maybe
or to
there's
push
no
15
food.
buttons on the telephone to get to something.
Yes. And so we kind of are the person to oversee that, to call in caregivers if caregivers are needed. So we really, and just to say too, that we not only are with the elderly, I have a client right now that the mother is the caregiver of a child that has special needs. And
we have some disabled.
Yes. And I do have, a nurse advocate now that I just hired over in Pasco County, that she has some background in special needs kids and was a school nurse at one time. And so I'm going to be starting that service as well soon.
That's exciting.
And I'm really excited. I'm trying to find what are the needs in the community and develop the services around that, because I have the ability to call in the nurses and train them as advocates. If they come with those skills, I can train them. And so I say, the sky's the limit for me as far as what I can do to help people. And I'm always listening. Autism, like it was on my brain when we were talking, and I also have a grandson with level 1 autism, and I've had firsthand having to go and advocate for him up in New Jersey because he wasn't getting the care that he should get within the school system. Right. So that triggered me to say, after I had to go actually do that and say, I'm the patient advocate. I'm like, I'm going to do this. So that's on my radar too. So I love working with the elderly, but what is really giving me a lot of self-satisfaction and is to be able to really be able to make an impact in the community, not just on one. Yeah.
Well, if you can see something that you do for young children, you continue to see them grow and everything. A lot of your elderly patients are only going to be around for so long.
Yes.
And it's wonderful if you can give them the highest quality of life for the last years of their life, whatever. But I think when you can do something for a child, that can be life-changing. And it can just be a program or the right teacher or the right medication or not medication. It's so fulfilling.
And my grandson, after that experience up there, we took him out of the school system. We put him in a private Catholic school. He has no IEP now. He has no aid, and he is doing amazing. So that's driving me right now. And also what drove me to initially become a patient advocate was because of the experiences with my mom and my dad, especially my dad. And he was such a fighter, and he ended up with kidney failure and went on dialysis. And you know what dialysis does to you. Yeah. And my dad said to me one day, he must have been about 69 or 70, and he said, "I want a new kidney." And I said, "Dad, you can't have a new kidney. You're 70 years old." He's like, "No, Lori, I want your help. I want to do this." And I'm like, "All right." So we started the process. And of course, right at first they said, "You're too old. You're too old." So you know what we did? We went up the chain of command at the transplant hospital. And finally they agreed to give my dad an older kidney.
Okay, fine. Wow, he doesn't need a brand new one.
Right.
He can have a used kidney.
So he got his kidney and he lived another 5 years, no dialysis.
There you go.
Oh, that's wonderful.
And so the quality of his life, and he advocated as much for himself as I mean,
God bless him.
Well, you had to learn it somewhere.
I think so. But I mean, just those are the kind of experiences that I had along the way that made me want to.
Well, I think many people in this industry.
Yeah.
I took care of my mom. I took care of my dad. I took care of my spouse or whatever. And they find a need, even if, like people that have products out there. So I deal with a company called AE Corner, and they check out all the products all over the industry.
Yeah.
And they'll be part of the next conference, and they just show you and everyone that's developed something, it was because of my mom, my dad, or whatever.
It's so true.
So how do people find you?
So you can find me on my website at www.steppingstoneadvocacy.com, or you can call me at 301-325-8208. And you'll get me, and it's a free initial consultation. I listen to where you're at, what your needs are, and try to come up with a plan to help you to meet the needs of your loved one or yourself.
Okay, so I'll put all that information in the show so you have it. What's the last thing you want our caregivers to hear today?
I want you to know that there's a lot of people out there trying to help you and to get the support that you need in the home or wherever you are being a caregiver, and don't give up.
Yeah. Well, thanks so much. We're going to go hear from our wonderful partners right now, because you know the deal. If you don't hear from them, you don't hear from me. So don't go away. We'll be right back on Connecting Caregivers Radio.
This is the Tan Talk Radio Network.
Arden Courts is not just a place to live. It's a place to call home. Residential living combined with quality caregiving. This is the philosophy behind Arden Courts. Communities created exclusively for individuals with Alzheimer's disease and related dementia who would benefit from a safe and structured environment. For additional information about any of the unique services Arden Courts provides, call 888-478-2410 to locate a community nearest you. Inquire about our educational seminars, resource library, or support groups, or simply feel free to ask questions you may have about Alzheimer's and related dementias. At Arden Courts, we know, we understand, and we can help because memory care is all we do. Remember, call 888-478-2410 for additional information about any of the unique services Arden Courts provides.
Are you getting older, or are you taking care of somebody who is? Getting older creates new problems you probably never imagined. One of the big ones is, how do you pay for care? Care in your home, care in an assisted living facility, or care in a nursing home. Did you know that nursing home care in our community can cost up to $12,000 per month? For the last 33 years, our office has helped families access benefits, including Medicaid, VA, and PACE, to help pay for the cost of long-term care. Regardless of what your assets are or what your income is, you can qualify for these benefits. Proper planning and guidance are absolutely necessary to avoid being wiped out. Let us help. If you are in care or heading in that direction, we can help solve that problem. Take action now to obtain benefits to pay for the cost of care. Here are the 4 things that you need to do. 1, get a new power of attorney. Your old one probably isn't good enough. Get a healthcare surrogate and a living will. 3, get an estate plan that will not disqualify you from benefits. And 4, get a plan to qualify for Medicaid, PACE, or VA benefits to pay for the long-term care costs. Call us today for a free consultation, 727-539-0181, or go to flmedicaid.com and download our free book on Medicaid and planning for long-term care. I'm Sean Scott. I'm here to help.
Guaranteed to make you laugh through your tears, Linda Burhan's book, Good Night and God Bless, is filled with humor and heartfelt inspiration to aid anyone facing the challenge of caring for a loved one at the end of life. Her story offers hope for human strength and understanding of weaknesses during a difficult time. Life doesn't normally prepare us to become a loved one's caregiver. When it happens, it's usually sudden. A diagnosis of an illness, age-related frailty, dementia, and life suddenly is anything but normal. And because we don't even know what we don't know, where do we turn to for help or guidance? In Connecting Caregivers, Answers to the Questions You Didn't Know You Needed to Ask, Linda offers information, education, and inspiration from her own experience and from experts whose advice, practical tools, and personal stories will empower and guide you. Make sure to add these inspiring books to your collection today. Available on Amazon.com.
This is the Tan Talk Radio Network.
And we're back, just having a couple of laughs here. So now we're going to talk to Nguyen. We met networking through Arden Courts recently.
Yeah.
And like I said, I'm so glad to be surrounded by professionals in the community that want to make a difference. And I love everything that you're doing. So tell us a little bit of background about yourself.
Yeah. So my name is Nguyen, and I am a doctor of physical therapy. I'm also a board certified neurologic specialist in physical therapy. So I graduated from PT school in 2019 and had always wanted to be a neurotherapist. My granddad had a stroke in high school when I was in high school. So I was living in Vietnam at this point. I didn't come to the state until I was a senior in high school. So at that time, the rehab in Vietnam was not very developed, and I'm not really sure where it is now. But pretty much after you have a stroke, you just go home and continue to live life how it is without any kind of rehab or any support or anything like that. So he did not have PT, OT, speech. He also was aphasic, so he couldn't communicate, and he could understand everything you say, and we knew that, but we just didn't know what it is. And and when you cannot communicate, you're pretty much just not in the picture anymore. No one pay attention to you.
Yep.
No one listened to you.
You get depressed.
Yep. So he continued to live for a few years and was pretty much like bedbound, wheelchair bound. So I knew that there has to be some other way for people to get better after such a neurological event. So when I was in undergraduate, I was in the pre-med track, and was just trying to figure out what to do. I shadowed different professions, and I was pre-dental, was about to go into dental school. And after I shadow a dentist, I'm like, this is not for me at all. I like to talk to people. Being a dentist is kind of hard to do that.
You can talk to them, but they don't talk back.
I know. I mean, they try to talk back. I feel like I always try to talk back at the dentist, and they were just like, well, you can't really hear what you're saying. So I shadow a PT. She then told me about therapy in rehab. So I also did some shadowing in inpatient rehab too, and really fell in love with that. It's exactly what my granddad needed when he was going through his stroke. So went to PT school, graduated in 2019. I went to work at my dream job at the time as a new grad in inpatient rehab at Largo Med. Great experience. I saw a lot of people post-stroke, brain injury, spinal cord injury, and then your general geriatric population. So it was such a great environment. You see people making really big strides and really huge recovery after stroke. But the problem is after they leave rehab, they have nowhere to go.
Right.
So they would go home with home health, which is fine. They're good at setting people up in the home environment, making sure that they can do their basic transfer. But when we call them to follow up, they would pretty much just say that like, oh yeah, home health discharged me, and then I'm just home.
Right.
And I'm not really doing anything.
Right.
And we all know that with any kind of neurological conditions, the rehab that you get in the hospital and the rehab that you get at home is just not enough. Because you have,
I tell them when you rest, you rust.
Yep. So you just have, your whole life to live, and you want to live it as fully as you can. So I didn't know where to discharge my patient to. And I know that there was a need in the community for neurological rehab. And I started my practice in 2023.
It's exciting.
Yeah. So it's been really great. We just celebrated our 1 year in our brick and mortar location yesterday.
Yay.
So we've been, I was mobile for a while by myself. So I was going into people's home.
Do you still do that? Does any of your team still do that?
So it's really just depending on like where the patient is. Yeah. So what we typically do is when they discharge from the hospital, if they're too high level for home health, so they're not technically homebound, we would go into the home and making sure that everything is set up. And then we'll see them for a couple of those visits, make sure that caregiver feel comfortable getting them in and out of the car, and then we transition them into outpatient.
And then do you help coordinate their speech therapy, their all their therapies?
So we provide physical therapy and occupational therapy in our clinic, and then for speech therapy, then I do refer them out to a couple of speech therapists that I work with.
Because I think it's so important with any kind of therapy. Even like, I broke my wrist a couple of years ago, and when they took the cast off, I said, "Am I going to get physical therapy?" He said, "No, just move your hands around."
It's always
I'm like,
no.
"What are you talking about?" Because I'm telling you, I could only raise my hand that much. Well, now I can do it like that because I went to physical therapy 3 times a week for 6 weeks or whatever it was.
We have
we have to insist on it, people.
Yeah, we have a patient this morning with multiple sclerosis, and she's been seeing a neurologist for a few years in her diagnosis. The last year, she's been falling a few times. And then the neurologist basically just said, look, just keep doing what you're doing. We're not going to, order you PT or anything like that. And I'm like, obviously what she's been doing is not working.
Exactly.
So,
and that's why you need to be that advocate. You need to insist to say, I want physical therapy. I feel I need therapy. I'm not ready for this yet. You're entitled to it.
Yeah, for sure. And
that's why we need Lori.
Yep, that's why we need patient advocacy.
Yeah, and I would say too, to that point, sometimes insurance gets in the way of things. And so what we do, I forgot to tell you that I do have an insurance advocate that I work with too, actually, that help with billing and also help to fight appeal denials. So we really do fight and advocate for services as we can. So if you have a patient that really you think needs it, and
because you don't have time to do that.
You don't have time to do that, but we can.
Yeah.
And I think that's where the team comes together, the healthcare team.
Yeah.
We need a team. It takes a village.
It does. And a lot of people don't understand. Well, since we're a new profession, people are still kind of in their silos, and that's where we run into trouble. So I've been trying to get the word out too, that we're all like you said, it takes a village, and knowing the resources now meeting you, it's just every time we do something like this, I learn more about the resources.
I see people get discharged from the hospital and they give them a Xerox copy of home health. And I look at that and I'm like, they're not in business anymore. They're not in business anymore. They're not in business. How is that helping anybody? And then just get frustrated, and then probably they won't do anything about it.
It's exactly right.
Yep.
And I'm not saying, the hospitals are there to do what they have to do. We all got to find a part.
Yeah.
And that's why it does take a village and it does take a lot of coordinating to do.
Mm-hmm.
But there is help available.
Yeah. And a lot of the time too, even if they don't start with us in outpatient and they're going home with home health, if they contact me, I would personally go and find a home health company that would specialize in what they need. We have a patient with spinal cord injury a couple months back, and they wanted to go home with home health because he's just not ready for outpatient. So I call a different home health company and make sure that they have therapists who has experience with spinal cord injury. So I would do that for people.
So what are the majority of your patients? Parkinson's, Alzheimer's, dementia, what are the majority?
Yeah, so I would say Parkinson's and strokes are our biggest population that we see. That's about 60% of the practice. And then we see people with multiple sclerosis. We see people with Guillain-Barré.
What's that?
So it's a autoimmune disease that the virus attack your own nerves. So it's a neuropathy, you get muscle weakness. The good thing is most people recover 80 to 90%.
What's the name of it?
Guillain-Barré.
Oh.
Yeah, so it happens a lot like after a viral infection. So there were some study, coming out after COVID with people getting Guillain-Barré after COVID. It can happen with any type of like cold viruses. So yeah, I see a lot of that in the inpatient rehab. Most of the time they'll recover by the time they get discharged. So if there's any residual weakness and things like that, we do see them in outpatient. But MS, and then we also see a lot of vertigo and dizziness.
Let's talk a little bit about vertigo and dizziness. I do have that issue every now and then. And my chiropractor tells me this thing, I gotta lay down on the bed and hang my head, whatever. What is that from?
There's just so many different things when it comes to vertigo and dizziness. So a lot of it.
I think I'm just basically dizzy, but go ahead.
Yeah. So you hear a lot about like positional vertigo. It's that like, intense like dizziness where things are just spinning around.
Yeah, I felt like my chair was breaking in my bedroom.
Yeah, and it's a lot of the time it's when you roll in bed and getting in and out of bed. That head hang position is what really bring it on. So positional vertigo is the most common, and we have a maneuver to get the crystal out of the ear.
Yeah.
I know every time I talk about the positional vertigo, I feel like I'm talking about witchcraft.
Exactly.
Yeah, there's some crystal in your inner ear, and then we're gonna move your head around, and then the crystal gonna go back to where it belongs. But that's pretty much it. And then there is hypofunction of the vestibular system. And it can happen as you age also. So we see that pretty frequently in a lot of people. A lot of the time people go to your typical traditional PT office, and then they would get the maneuver, and that wouldn't solve the issues because they're two different things.
Yeah.
So with the hypofunction, there are different exercises that we call gaze stabilization exercises that we can do to get the reflex working. So it's just so many different things. A lot of the dizziness also come from the neck too. So cervicogenic dizziness is coming from neck pain. There's just so many type of dizziness that you need a comprehensive examination.
I'll just get it like once a year. I'll get like a bout of it, and then it goes away. And I go to the chiropractor every Monday morning. That's just part of my regular health routine kind of thing. And I think that makes a big difference too.
Yeah. So if it's cervicogenic, definitely. So like head and neck manipulation, that can help with that. With hypofunction, you need the gaze stabilization exercises. Sometime with positional vertigo, just moving around throughout the day and getting in bed, like you would just get the crystal back to where it belongs anyway. So you don't need the special maneuver. But in extreme cases, you do need that because it's so intense. And if you haven't experienced it before, it's like the worst dizziness ever. Yeah, because the second you lay down, like
the first time it happens,
spinning.
it's really scary.
For sure.
First time, but yeah.
Yeah, my mom suffered a lot from positional vertigo growing up. At one point, so they still live in Vietnam. So at one point I was trying to do the maneuver with them over Zoom, where I'm like, okay, hold her head like this, and then now turn it to the right. And then like you can see her eyes spinning even on video call.
Wow.
Yeah.
All right, let's talk a little bit about Parkinson's. What can we do for Parkinson's people?
Oh, so many things.
And I think I want to talk about that because
Yeah.
a lot of people I think get the diagnosis and think it's just the end.
Yep. Yeah. So I think the image of like the people with Parkinson has changed over the year because there are now younger individuals with Parkinson's also. So it's not, you're a typical geriatric who's like hunched over and like really slow. We have so many Parkinson athletes that I have the opportunity to work with. They're older, but they're still out there, doing their boxing classes.
I love the Parkinson's boxing.
Boot camp. Yeah, they're doing boot camp classes. They're amazing, and they're always just the nicest human beings. And have great caregiver and really good support. We always try to advocate for them to see a movement disorder specialist. So that's the biggest thing when I talk to someone during my initial evaluation. Who is your neurologist? Are you seeing a movement disorder specialist? It's make a huge difference. And there's research showing that people with Parkinson who are being seen by a movement disorder specialist live longer and have better quality of life versus seeing a general neurologist versus seeing a primary care.
Yeah, makes sense.
Yeah, because the medication can be changed, and like people who are specialized in Parkinson
know more about Parkinson's.
Exactly. That's all who they see all day, and they're very, very updated with the research. And there are new medication, new research coming out. There is a new research center in South Tampa that just opened a few months back called Axiom Health. So they're doing really great research in Parkinson and Alzheimer there. And then another thing is getting people into a community class. The number one thing that research has showed to slow down the disease progressions of Parkinson's is high intensity exercise. So that's really what we try to do during our physical therapy session together. It's not just exercising, but the correct type of exercise and the correct intensity. So we advocate for people to do their group exercise classes, go on walks and things like that, doing things that they enjoy doing. But during our physical therapy session, we really try to push that limit.
See, and I like that group. I think that would be better because years ago I used to take my brother for some Parkinson's stuff, but he was scamming it. Like he would drag his feet from the car, literally drag his feet from the car. And as soon as we got like 2 feet away from the clinic, he would start walking like he was supposed to walk. Well, you know what?
Because we're always watching.
Right, but that's not helping nobody. You know, like that's like not doing anything. And then one day his therapist told him to take a towel and just keep twisting it, like when he's watching television or something to have some movement. So that night he has a paper towel, and I'm like, kind of thing. We need to help ourselves.
He's a jokester.
Yeah, but who suffers now?
Yeah,
who suffers? Him now, unfortunately. I think we all got to keep moving no matter what, even if we don't have any kind of issues.
Yep.
Because if you don't move, you need to move to lube.
Yep. I always say the body in motion, stay in motion. So, you always got to keep moving all day long.
Yeah. So what do our caregivers need to hear from you today?
Are you talking about a caregiver with people with neurological conditions? Yeah. So
I want them to know that there's help and there's hope. So let's talk a little bit about that.
I think that recovering from any kind of neurological conditions or injuries or living with one is always an unpredictable journey, right?
And a challenge.
And a huge challenge. And I think that being a caregiver in these situations is really tough, not just from a physical standpoint, because a lot of the time they provide physical assistance, but also from an emotional standpoint. And I think something that we don't talk a lot about with caregiver is grief, right? You're marrying someone, and it is for
my life was not supposed to be this way.
So it's a lot of grief of like the people that you marry, and even in our Parkinson's patient too, like as the disease progresses, they become very flat. And like a lot of the time you can still like see the jokester in them, but they're so flat. And being a caregiver is tough because you're marrying someone so different. So grief is such a huge part of being caregiving.
And they're grieving, the loss of their plans, what they thought it was going to be.
We're gonna retire and we're gonna travel the world. it's a big grief.
Yeah, I mean, this morning I did a live support group at Arden Courts, and it was sad because everybody is grieving what they wanted to do and what they used to do and what their plans were, and that's not happened. It's a big deal. It's between grief and guilt. Because then we got the guilt. You know, like if I decide to put my one into a community or whatever, if I lose my patients or whatever. I'm sure you both see that.
Yeah. When we get the call, it's usually in crisis mode, and like I was saying before, it usually is that they're feeling overwhelmed, and so when I'm listening to what their diagnoses are. But really what I'm listening to is the emotional side, because that's a side that brings them to us to advocate for them. So I think that's the most important thing. And that's what differentiates us from like a case manager, because I did want to say that we are a concierge service. So it's not insurance. So when you call us, you're our client, we're not working for an insurance company or anything like that. And I think knowing that we're listening to you emotionally, that's what you're needing.
Just somebody listening to me.
That's what they need. And, you know, oftentimes I'm dealing with a client in a family right now, 5 children, and all on a different page on how they don't agree on how to care for their mom. And so I provide,
like a mediator.
Yes, I provide a lot of mediation, a lot of support, a lot of comfort, a lot of teaching, and to try to bring them all and keep focusing on their mom, because the mom is the one I'm advocating for. So you can get caught up sometime in that. And so I think that's where we both play a part in kind of keeping the eye on that patient.
And just definitely taking the time to do some of the thing that you plan to do with that person, right?
And you can still do some stuff.
And then talk to your therapist team. So we're really good about like, okay, this is your goal. How do we get there? How can we make compensation so that you can still do that? One of my dearest patient who passed away last year, he really wanted to go to California to visit his daughter. And he was partially wheelchair, using a walker, or falling a lot. And toward the end of his life, he was falling pretty much every day, multiple times a day. I remember coming to his house one day and I'm just like, anyone's home? And I can like see through the front door that he was like on the floor and there was just a pool of blood around. And I was just like, it's 8:00 in the morning. What is happening? So, but he's so wanting to do that. And I'm like, okay, we're going to do it. We're going to get you to California and see your daughter. And he made that trip. It turned out to be, you know, really, really safe, way safer than we imagined that it would be. And then he came back and he passed away very shortly after that. But he really wanted to do that.
Yeah, it's so important. It was so important.
And it's so important. And it's important for the caregiver too.
So where can our listeners find you?
So we're located in Pinellas Park on Boucher Road. Our address is 9079 Boucher Road North, Pinellas Park, Florida. And you can find us on our website at Nobility Rehab. It's spelled NEUBILITYREHAB.com. Or you can call us at 727-616-0809. And Lori's my admin who will take in your call.
Okay, and I'll put all that information in the show. And please, you know, we're talking about this and we're talking about getting support. I can't emphasize enough to get into a support group. Just get into a support group. You know, this morning I did a support group. Every time I walk out of a support group, I feel so good because people are getting help and because people, you know, like, one woman didn't say a word, and I'm like, are you okay today? And she started crying. Yeah. I'm so glad you could do that. You know, I'm so glad, and we could be there to support her.
Yeah.
You know, and I do an online support group. I do an online journaling workshop every month. And I'm not the only girl on the block. There are a lot of other support groups that I can give you information about if you need. But I think that is the biggest thing because we don't want to be alone. We don't want to isolate ourselves. And when you get into a support group, you find out information about other things too. Doctors, lawyers, you know, whatever kind of thing that's going on. So please do that. But right now it's time to hear from our wonderful partners. So don't go away. We'll be right back on Connecting Caregivers Radio.
This is the Tan Talk Radio Network.
Choosing the right chiropractor is an important choice to make. Located in Seminole, the Alexander Spine Center team is trained on the latest chiropractic treatments and technologies. At Alexander Spine Center, you'll find chiropractic and physical therapy care that is safe, effective, and a natural approach to pain and other health-related issues. Chiropractic unlocks your body's potential and natural healing process to ensure your life is a healthy life. We treat clients from the womb to the tomb. Call 727-397-3000 for a free consultation today, or visit our website at www.alexanderspinecenter.com.
They take good care of me twice a week, so check them out.
Arden Courts is not just a place to live. It's a place to call home. Residential living combined with quality caregiving. This is the philosophy behind Arden Courts. Communities created exclusively for individuals with Alzheimer's disease and related dementia who would benefit from a safe and structured environment. For additional information about any of the unique services Arden Courts provides, call 888-478-2410 to locate a community nearest you. Inquire about our educational seminars, resource library, or support groups, or simply feel free to ask questions you may have about Alzheimer's and related dementias. At Arden Courts, we know, we understand, and we can help because memory care is all we do. Remember, call 888-478-2410 for additional information about any of the unique services Arden Courts provides.
We believe the power of the human body and mind can do amazing things, and that tapping into that power, not just tricking it with a temporary disguise, is possible. Superpatch technology uses a special pattern and vibrotactile technology to help you go from feeling blah to hurrah. Now, once the Superpatch is in contact with your skin, it triggers a neutral response in the brainstem that helps you tackle your daily problems head on. Whether you're struggling with pain, balance, stress, or focus, we have a solution that might be right for you. With Superpatch's 30-day money-back guarantee, you have nothing to lose and everything to gain.
Hi, this is Linda Burhans, the gal who cares for the caregivers. I started using the Liberty Patch over 3 years ago. I used to be a tripper, but since wearing the Liberty Patch, I haven't tripped once. The Liberty Patch is proven to reduce the risk of falling by up to 8 times. And as we all know, if you prevent the fall, you prevent the call. Don't wait until it's too late. Preventative solutions are the answer.
Superpatch does not claim to diagnose, treat, or cure illness. Superpatch is FDA registered. To receive 25% off your first order, go to sticktoit.info. That's sticktoit.info and learn more.
This is the Tan Talk Radio Network.
And we're back. So we have some things coming up. Number one is the Connecting Caregivers Conference, which is May 6th, 7th, and 8th. Please go to connectingcaregiversconference.com. And register. It's free to caregivers. It's totally virtual. We have great speakers. We have great information. I understand it's difficult. A lot of people say, well, I can't come all the time, or I can only come a little bit at a time. Come when you can. As long as you register, within 30 days, you'll receive all the videos of the conference to share whenever you want, because I get it. You know, I hear it all the time with the radio show or whatever else is going on. Linda, it was really good until mom had to go to the bathroom, and that was the end of that. But that's okay, because we have plenty of time to do everything else we want to do. Also want to bring up Sages, who that's Plays with Purpose, and their new show is Phony Baloney, and it's all about scams. And, you know, lots of times nobody wants to think about I might be the one that could get scammed, but anybody can get scammed. And I love all their plays because they give you information with humor. And I go to their shows and I'll see 2 girls sitting next to each other and they're listening to something they say and they start poking each other like, meh, I need to listen to that one. Or, I got one of those calls too. And I just want to mention one of the most recent scams they're doing is they'll call you up and ask you if you're going to be home, that they have a delivery for you. And then they come to your house and they bring you a big bouquet of flowers and a bottle of wine. And they tell you because they're delivering wine, they have to collect this little kind of special tax and they can only take it on a credit card. I could have fallen for that myself. You know, why would somebody be giving me a bouquet of flowers and wine if they were scamming me? But once you give them your credit card, they got you. Mm-hmm. So please be extra careful. Be extra careful. You know, you could always just say, well, who sent this to me? And then call them on the phone and find out if somebody really did send that to you. But please be careful. So the next show is tomorrow at 2:00 at the Catherine Hickman Theater in Gulfport. At 2:00, and then on Saturday the 19th at the Murray Theater at Ruth Eckert Hall, woohoo, at 2:00. It's best if you can register in advance. And so you can go to Sages Theater, SAGESTHEATER.org. So glad that you've been with us today. Hopefully we always give you really good information. Please be kind to yourselves. Please give yourself a little break. When somebody asks you, how are you doing? I don't want to hear from you, I'm okay. Because that's what the caregivers say all the time. And most of the time it's furthest from the truth. Let people know that you need help. Let your neighbors know the situation that you're in. In the back of my business card, it says the person I'm with has Alzheimer's or dementia, may not clearly understand what has been said. Please be patient with them. Use those cards to your advantage. I'll give you as many cards as you want. You go into a restaurant, if you give that to the server, they're going to be kinder to you. One of my caregivers a while ago came and took some from a support group. And then the next time she came and she asked, could she have 14 more cards? And I was like, yeah, all right. I gave her 14 more cards. And then she came back and she said, those cards saved my life. And I said, what are you talking about? So I live in a mobile home park and my husband has dementia and he's starting to wander in people's yards. And when the dog goes to the bathroom, he's not always cleaning up the poo. And everyone is giving him dirty looks. So she said, so I went around and I gave one card to every neighbor. And they said, he can come in our yard. We'll clean up the poo. Maybe he would like some lemonade. So now she has a whole people surrounding her to help her that can understand what's going on. So tune in next week for another fabulous show. Remember, God loves you all the time and have a delicious day.